Thank you, Tyler. Welcome, everybody. I've been tasked tonight to talk to you all about my travels from my standard inpatient operating room to and through the journey to get to my outpatient operating room. In order to do this, over the last year, we have chosen to use the GMK efficiency instruments supplied to us by Medacta, and throughout this, I'll be referring to the Sphere knee, also by Medacta, that we have used. Why the efficiency instruments? I was looking for something that gave me one single pack of instruments, not just pieces to use with my other instruments. This instrument set clearly provides that. Other benefits are that these are extremely light and well packaged. They come to us in our operating room terminally sterilized, and that has to represent a lower infection rate than my heavy trays, which have to be transported back and forth with occasional holes in the packaging and perhaps even unknown holes that I haven't ever found. Throughout all this, I don't need to transport trays back and forth. Sometimes I tend to do 8 or 10 cases in one day, and the ultimate difference in the weight of instruments that have to be transported back and forth is spectacular over the course of one day, much less the course of a year. Every time I need an instrument, they're there. They're brand new and they're sterile. If I happen to, perchance, drop something on the floor or somebody turns the gravity up, I don't need to wait for a flashed instrument for perhaps 15 to 20 minutes. If I had to, I can simply open a brand new, once again, completely sterile instrument. The other wonderful thing about these instruments is that they are reproducible. Every time we open a new box of these, we end up with the exact same predictable, very useful instruments. I initially began my journey doing 133 cases of the Sphere with conventional steel instruments. I was then fortunate enough to migrate into the efficiency instruments, and we've now done just over 350 of these. My experience pales to the nearly 5,000 of these that have been performed successfully now throughout the world. One of the blessings of these instruments is that my workflow really is smooth and hasn't changed at all. I begin my case with the tibial first cutting system, and here pictured is the external tibial cutting guide that I use. The set also provides for an intramedullary set if you'd like to use those. In vivo cutting of the proximal tibia is easily accomplished with these instruments. The nice thing about this guide is it allows independent setting of your tibial slope, your varus valgus, as well as cut depth, each of individual steps before pinning your guide into place. Following that, sizing, drilling, and punching of the tibia is easily accomplished. Moving on to the femur, the distal femoral cut is via an intramedullary rod. The varus valgus angle of the distal femoral cut is set by use of pre-packaged plates, and then the depth of your cut is easily independently established. The femoral sizing guide is an intuitive device which we use. It's very versatile, allowing independent control of your external rotation in either 0, 3, or 5 degrees, as well as the instrument can be used at your discretion in either a posterior or anterior referencing system. Double checking of your sizing throughout the case can be done with an anterior referencing guide that's provided. Following this, a robust 4-in-1 guide is supplied that easily fits over the pins and provides finishing cuts on our distal femur. Ultimate trialing in both extension and flexion is easily accomplished with these instruments. Now that I had done over 100 of these in the inpatient setting, I was very anxious, as were my patients, for us to move into the outpatient setting. Waiting for us was our outpatient surgery center, as they too had been prepping and were quite excited and ready to move into this theater. As we moved into the outpatient setting, though, numerous challenges ensued. The biggest one, as we've heard earlier in Dr. Goldberg's talk, is in instrumentation. We also were going to require very skilled anesthesia to perform blocks for us in order to achieve long-term pain control and allow these patients to go home in a brief period after their surgery. The other issue that had to be dealt with was cost of getting these cases accomplished. Ultimately, the set on my left is what my normal case used to look like. Through the use of the GMK efficiency instruments, much like Dr. Goldberg, my complication of instrumentation was greatly reduced. These instruments allowed us to seamlessly move into the outpatient setting without any change in the workflow whatsoever from our inpatient setting. We had the same instruments delivered in the same boxes and the same peel packs as we used in an inpatient setting. In the inpatient setting, I can simply do as many cases as my operating room will allow. One of the big problems in the outpatient setting, as you heard, is that instruments simply cannot be turned over. One set of instruments would be difficult, much less 5 separate trays for each case. So conventional instruments effectively are difficult to use and perhaps even limit you to a single case. The people in our outpatient setting with steel instruments had told us how much they disliked having to stay over the night before in order to receive these instruments, to package them, and then just sterilize them tray by tray by tray in order to prepare for just a single case the next morning. They have really loved our instruments that now can be delivered the day of and be delivered in a volume that is simply determined by how many cases we'd like to do. The nice thing about these instruments is indeed they can simply be brought on site via normal transportation. They don't need to be specially bagged at all. And once again, we can bring them on the day of. We don't need to have long-term specialized storage for these at all. This allows us to easily accomplish multiple cases in our outpatient setting. The staff is the one that perhaps is the most pleased with these in the fact that these instruments are very lightweight. As Tyler showed, and indeed we had to weigh these as well, our instruments weighing just under 8 pounds and our normal steel instruments with 5 cases weighing just under 85 pounds. We did a little math and figured out that over the case of 300 cases that I average in a year, that this was approximately 11.5 tons of weight difference that our nurses did not have to lift, carry, and move. At the end of the case, these instruments simply get pushed off the end of the table into the garbage bin. They do not have to be reprocessed, re-sterilized, washed, or handled. The cost of these is wonderful in all settings. In the inpatient setting, you heard Dr. Goldberg break down the cost of these, and indeed, our hospital initially balked at the thought of having to, quote unquote, pay for instrumentation. However, once they began to look and realize the savings that were associated with these instruments, they have indeed encouraged their use. In the outpatient setting, these cost savings are mirrored. I thank you for listening to me as we've walked through a brief discussion of how I got to the outpatient setting from our old steel inpatient setting. Thank you for your time, and I'll turn you back over to Dr. Goldberg.